Hello everyone. We saw this patient in the clinic last week. GK, 47 years old, is a non-Hispanic and a single mom, and she arrived in the clinic by herself, and she appears to be appropriate historian. And chief complaint: I have had headache for a month, and history of present illness. And a 40 years old woman complains of having headache for over a month. She claims that pain is persistent and affect both sides of her head. According to the patient, the pain is 6 out of 10 and last a few hours, and the patient claims she can continue with her regular activities, but it is uncomfortable. The only things that assist Tylenol, ibuprofen, and rest. The patient claims that it appears out of nowhere. She says it can be stressful because she is now enrolled in school, working full time, and raising two children alone. Past medical history: no medical history, just only headache. And surgery: no surgical history. Preventive care: annual physical examination June 2022, dental examination August 2022, eye examination September 2022, and pap smear in December 2022, mammogram in July 2022. Non-hospitalization. Allergic denied. Any environmental, food, and drug allergies. And last menstrual period on May 2nd and negative for HCG. Medication: ibuprofen 200 milligram by mouth, 1 tablet every 8 hours, PRN as needed. Tylenol 500 milligram by mouth, 1 tab every 6 hours for headache as needed. And the family history: maternal grandmother died 88 of rheumatoid arthritis, and maternal grandfather died 86 years with MI and stroke, and paternal grandmother died at 78 years of heart failure, and paternal grandfather unknown, mother hypertension, hyperlipidemia, alive, and father alive with hypertension, daughter healthy, and son healthy. And a social history: sexual history, and she used condom as protection during sexual activity with a single partner, and denied any using tobacco and any other drugs. And diet: exercise and consume a balanced diet, dines out twice per week, walks for 30 minutes twice per week, has a 2 cup of coffee and 1 soda per day, and occupational, works every evening as a nursing aide, and sleep 4 to 5 hours each day, and a review of system: a general, denied fever, chills, fatigue, and change in appetite or weight changes. No non-allergies, no skin problems, and no any eye vision problems, just complain of headache and denies any head injury. And mouth, throat, nose, and ears, denies and swallowing difficulty, sore throat, and hearing problems. Cardiac, deny chest pain and irregular heartbeat. No shortness of breath, and musculoskeletal, no muscle pain and joint pain. Denies any easily bruising, and neurological, denies memory loss, numbness, tingling, and dizziness. And psychiatric, she stated that she stressed out easily and denies anxiety, depression, and sleep disturbance, and denies cold and heat intolerance. Objective vital sign: blood pressure 124/76, heart rate 82 per minute, respiratory rate 16, oxygen saturation is 99% room air, and pain 0 out of 10, and height 5 feet 5 inches, weight 160 pounds, BMI 26.6, overweight. And physical examination, journal appearance, patient alert oriented. Times 4, she appears well groomed and dressed appropriately, and no acute distress was noted. The head is normal shape, has no evidence of any mass and deformities, and no discomfortable when palpating the sinus. And ENT, tympanic membrane appropriate in color with a good cone of light, bilateral ear canals clear, and the oral mucosa is pink moisture and without lesions. The nasal mucosa is pink and no tenderness and no nasal discharge noted. Eyes pupils are equal and reactive to the light. Conjunctiva pink and sclera white. Extraocular movement are intact without sign of nystagmus. And musculoskeleton, full range of motion in all extremities, no joint pain, tenderness, or deformities noted. And psychiatric, dress appropriately and has an appearance of anxiety and depression. Neurological, calm and cooperative, no acute distress, answering the question appropriately. Assessment and differential diagnosis, tension type headache. And tension type headache account for 2 of the 4 features of headache: bilateral location of pain, mild to moderate intensity, and pressing or tightening quality. It is the most logical diagnosis. Lack of sleep, stress, and irregular eating habits are contribute to the aggravation of these headaches. And migraine headache, my second differential diagnosis in other possibilities, a migraine which is throbbing, pulsating pain to one side of the head that lasts for 4 to 72 hours and is make worse by increased sensitivity to light, sound, and smells. And temporal arthritis, and although a more urgent diagnosed temporal arthritis is accompanied by fever, lethargy, and weight loss. This patient did report that over-the-counter drugs did help that her headache, even though these symptoms don't typically react to the over-the-counter meds. The leading diagnosis is tension type headache, and diagnostic test no required because the neurological examination was normal. And acute tension type headache can be treated with over-the-counter medication and Tylenol and ibuprofen. Education patient about keeping headache track, the frequent intensity drug that helps, and this can also help identify potential headache cause, learning relaxation techniques, and improving sleep hygiene, and are also included in non-pharmacologic therapy. The technique can help cure current tension type headache and help avoid them in a future. So referral, currently known referral needed. So follow up if symptoms don't appear after a month, follow up in the office. Thank you so much, everyone.